Well, hello, welcome to this week's Clarity Parents Chat. Today's topic that we are going to discuss is understanding self-harm and the difference with suicidal ideation or attempt. Now, this is a very important topic. Actually, last weekend's Wall Street Journal had an extensive article about teenage mental health, and it read, I quote, in 2015, 3 times as many 10 to 14-year-old girls were admitted to the emergency room for self-harm as in 2010. And according to the CDC, the suicide rate for girls 15 to 19 doubled between 2007 and 2015, although it's still far higher for boys. So this is a very big issue, of course. And today with us, we are going to have a conversation with our speaker today, Carver, who is the CEO and Vice President of Patient Services at Clarity Child Guidance Center. Now, for those who are not familiar with our organization, Clarity Child Guidance Center is a nonprofit treatment center solely dedicated to helping children 3 to 17 with their mental health. We're located in the San Antonio Medical Center and provide inpatient and outpatient services to several thousand of children every year. You can read more, of course, about the center at claritycgc.org. Now, Carol began her work at Clarity as an RN staff nurse in 1982. She recently obtained a master's in nursing at Walden University, and she has held several different positions over the past 30 years, including nursing supervisor, director of nursing, acute care program director, and quality assurance coordinator. Currently, Carol serves as a senior vice president and COO, and she participates in community presentations on mental health issues and is a member of the American Nurses Association. Carol, welcome.
Hi, my pleasure.
So, I started with big numbers, but let's go back to maybe some more specific thing. Can you give us a definition of what self-injury is or self-harm?
What the title or what we currently call this is non-suicidal self-injurious behavior. In the past, it was called self-mutilation. So now a common term for this is non-suicidal. And typically what this means is injury, self-injury, that is usually superficial, not life-threatening, and the intent of the injury is to manage emotional distress. And this can result in distracting from overwhelming emotion. It can also be result in physical pain that allows the person to feel something when they're feeling numb or there's a lack of feeling. It's a form of control, taking back control when the adolescent feels out of control or the child feels out of control. And it can also be a form of self-punishment.
Okay, so there's really, and it's interestingly, an array of reason almost or motivation for someone to engage and continue in that. I heard that is a release of some adrenaline when you have this pain, and it kind of soothes the pain, right? It's a way to.
But I think it's important to remember at the core, it's to manage emotional distress.
So that is the underlying issue, exactly. Now, can you tell us a little bit about some of the common forms of self-injury?
Yes, common forms are cutting, superficial cutting, hair pulling. This can be something as subtle as twisting your hair until it comes out. It can be scraping, rubbing until you get an excoriation or an abrasion, burning, hitting oneself, picking at skin, and especially if an area is trying to heal, picking to prevent healing. So those are forms of self-injury.
And what is the extent that it can take? I mean, you're talking about, we see sometimes cutting, I mean, what have you seen, or what can you tell about the extent of that can take?
Well, I have seen some patients with extensive cuts all over the body, particularly in areas that are not readily visible when clothing is worn. And you will see them in various stages of healing. There will also be multiple scarring and especially if the problem is chronic.
So cutting on the body, you can see the cuts. Are there other ways that are very easy to dissimulate, really? Because that's a big thing, right? The cutter wants to hide.
Right. And also there, you can also see like scabs or wounds, that there's sort of a delayed healing, and because the child keeps picking at it and picking at it. And so like a failure for something to heal that would normally heal over a few days can sometimes take days and days to heal. Bald spots. Sometimes girls will wear their hair a certain way to cover up the areas that of hair loss.
Mm. And does that happen, like, if we look at the timeline, is it something that happens very fast, and or like, if someone starts cutting, she's gonna cut extensively very quickly, or is it very progressive, and does it stop? How does that, what's the
I think it
time?
varies. I think it does vary. There are some instances where a child may try it and they don't get the result that they were hoping for, so they don't self-injure any longer. There are some children or adolescents who have self-injured for years. And this is a very, very solidified coping skill. This is like, for example, let's say you use exercise to cope. Well, that is something that is very developed in you as a coping skill. So that's something that you will use automatically when you
Right.
start feeling your stress level go up. Well, it's the same thing with self-injurious behavior. When a child's stress level goes up, then their cutting or their self-injurious behavior will increase because they're trying to manage the increased stress.
That
And
makes
there
sense.
are times when this self-injurious behavior goes on for years. I had a patient one time whose parent was very frustrated with the child's self-injurious behavior, and I explained to the parent that this was a way that her child coped with her stress. And I asked the child, the teenager, I said, was there any time during the last 5 years where this behavior went away or was very, very lessened, would decrease? And she said, yes, when I played volleyball. When I was on the volleyball team and I was playing volleyball, I rarely self-injured. And that was because she was feeling better overall with this extracurricular activity. So it's important to remember that if you can replace the self-injurious behavior with something that is that facilitates um, coping, and it's pro-social. It's something that is healthy, that promotes health. That's what I'm trying to remember the word, health promoting. That you will see a decrease in some of the other non-healthy ways of coping.
That's really good. And I want to come back to that, because how do we deal with it, and how do we help those young people, teenagers? Now let's talk a little bit about the question of suicide, right? So that, how would you describe the difference between self-injury and suicidal ideation and attempt in terms of intent or action?
Well, the main difference is the intent. When a child self-injures or a teenager self-injures, their intent is to manage distress. When a person makes a suicidal gesture, their intention is to harm themselves or kill themselves. And it's sort of like that escape. I want to just end it. I want to remove the pain. I want to stop completely the hurting or the feeling, the overwhelming distress that I'm feeling. So while self-injurious behavior is more managing the feeling, a suicide attempt is to discontinue the feeling, to stop the feeling. Now, it's very important to remember that when somebody is self-injuring, they are in distress.
Right.
Just like somebody that is withdrawing excessively, not leaving the house, those that may not be harming themselves overtly, but it's still a red flag that someone is suffering and they need help. And that can result in a suicidal gesture or attempt. So, you can't breathe a sigh of relief that someone is self-injuring to manage stress, because that stress can become overwhelming and it can lead to a suicide attempt or gesture.
So it's a at the same time, it's a little bit reassuring to say, like, okay, if my child is cutting, doesn't mean that they're suicidal, right? I mean, that still is kind of a relief for parents, right? To know, okay, so there is a problem, but if you don't recognize the problem or don't address it, and it could become more serious, right? That's basically
Right. You can say that it's not life-threatening at this point.
yeah,
Yes.
yeah, yeah. That's a very important distinction. Now, you said there is and that's maybe that was my next question. That's the relationship. There is a relationship between the two in the sense of that there's a sense of there's a distress, and that needs to be.
That's correct. That's correct. That the child, we have to keep remembering that it's an attempt to manage stress, and that stress can become overwhelming, and that the child needs to deal with that stress in a way that can be a pro health promoting management strategy. In other words, self-injurious behavior is maladaptive. And so you want to be able to work with a child in a way that becomes more adaptive.
Yeah. There are other underlying issues that could lead to suicide too, that like whether bipolar illness or serious depression or things. So maybe the question is do does cutting actually reflect some of those diagnosis, or is this separate? Is it a whole different ball game? Or
Yeah, that's correct, Gerard. We really don't know. All we know is that the child is suffering and that they need some type of intervention to determine what is the root of the distress, and how then can that be managed. It could be something that is not as serious as a psychiatric diagnosis, not as serious as something that will qualify for a diagnosis, but it could be a very high achieving person, someone that presents very well to the world, but has this secret and has this maladaptive way of functioning, that it just needs to be addressed.
yeah, I think
But in other areas, the child is functioning very normally, and in some cases, they're overachieving.
Right. No, I'm glad you're bringing that up, because I think there's, and maybe you can comment on the growth of, what do we see more and more, but there's that sense of pressure and how kids pressure themselves, and so they have to find a way to cope, right?
That's right. There is, I think children are, their world is much bigger now with the internet and with social media, and that is going to increase the pressure. It's going to increase the pressure. There's very little time for relief from that. And I also think that obviously the COVID hasn't helped that, because children are more isolated and adolescents have been more isolated. So that there's no surprise that this may be on the rise.
Yeah, and that makes me think the article I was referring to was actually an interview of Dr. Jean Twenty, who came to our Clarity Con, actually. I think it was the one in November last year. Anyway, we have a video of her representation, and she does talk a lot about social media, isolation, lack of actual social relationship or difficulties of having real connections. And so that is definitely a factor that parents need to be aware of. Now, other drivers, drivers of self-injury that we know of.
I think, they're all the triggers that occur for other behaviors. When children start acting out or teenagers start acting out. Particularly in adolescence, it's a time of change. There's a lot of body image issues. There's the question of, do I fit in? There's also the question of identity. Who am I? What am I about? And so all of these normal developmental stages and developmental issues can cause stress. I mean, as we all know, change causes stress. Sometimes it's good stress, sometimes it's overwhelming stress.
Right.
But adolescence is a very, can be very overwhelming in due to the changes that occur in the child and in the adolescent.
That's very good. And we're about to see some more changes, right, as they come back to school in person. Now, and I want to remind our audience, if you can put any question at any time in the chat box, I'll be happy to bring them up to Carol. Tell us a little bit about how we can detect, how can parents or teachers detect these behaviors or be on the watch for it anyway.
Something to remember, something very fundamental to remember, is that the child or adolescent who is displaying this behavior is ashamed and embarrassed. So it's very, very important to approach the child or adolescent non-judgmentally. Mm-hmm. It's very important to remember, and unfortunately, when we discover this behavior or this symptom, it can be very shocking for us. Right. It can be extremely disturbing. You take this beautiful child or adolescent and you see these cuts, and it's just a major, overwhelming reaction sometimes. You just want to rescue them. Right. You want to patch them up, focus on the injury. And really what we need to do is not pay attention so much to the injury and pay attention to what's causing the injury or what's causing the behavior. I used to train the staff on this symptom when they had to deal with patients that were displaying this symptom. And I would tell them, if you see a child crying, you would never say, "Oh my goodness, your face is wet." You would not focus on the tears. You would focus on the distress that is causing the crying. So you have to look at self-injurious behavior the same way. You don't want to say, "Why are you cutting? Why are you hurting yourself? Why are you doing something that is so not helpful? Why are you doing something that is going to hurt you?" Because a lot of times they can't answer that question. What you want to focus on is, I can see that you're upset. That's a really good way. That's a good empathy statement. I get it. I understand that you're upset. I understand that you may be experiencing something. And so that helps us frame our response. Is you shouldn't focus so much. It's not a good idea to focus so much on the actual injuries themselves and trying to fix that. What's more important is that you sit down with the child and you have a non-threatening discussion about what might be going on with them. What kinds of things are they experiencing that are causing this distress, and essentially focusing on the distress rather than the injury. And one thing to remember is that the child is going to be very protective of this coping skill. Just like the smoker, just like the person that overeats, you can't just say, "You've got to stop."
Right. I was going to say, yeah.
You've got to stop. This is not going to work. You have to.
Or punish the child, or try to get incentive, or reward the child for stopping. It doesn't work. It's like an addiction, right? You can't.
You cannot
manipulate them.
Right. You can't expect them to just stop the behavior. It's much like we spoke about earlier with the child that was playing volleyball. When she was playing volleyball, she was doing the self-cutting less, or the self-injurious behavior less. And that's because she was coping in an adaptive way. So it's very important to work with the child, get the child professional help so that they can learn to cope in more adaptive styles or more adaptive ways.
Yeah, that's a huge thing. So like if you basically the no more parents who actually want to protect, to stop it, then might trigger actually more of that behavior, right?
Well,
Because you want to take control, and then
right.
that means the child loses control, right?
But they'll also become more secretive about it, and they will also just get better at hiding it. And it will cause a lot of distress because then it will just focus on, will I be found out, versus how can I get help with this symptom? How can I get help with my distress?
So let's imagine a dialogue like I'm the young person who's cutting, and you just found out, and so your first response would be, or
My first response would be, you know what? I'm not even worried about that. Even though I am worried about it, even though it is disturbing me, I'm going to set that aside. I'm going to say, I am not as concerned about the cuts. I am not as concerned about you harming yourself, or because I know that we have a much bigger issue here, and that is that there's something going on, that there's something bothering you. And really, that's what I'd like to know more about. I really want to know more about what's bothering you. And I'm not really going to focus right now on your cutting, or I'm
okay.
not going to focus on your scratching or your picking. I think that that's something that really should take a back seat to what's bothering you. That's what I'm concerned about.
Yeah. Now, what is the next step? So the child has explained something, or maybe they can't really. It may not be that easy for a child to say, like I don't know why. It just makes me feel good. What is the next step for the parent? Or how can they
Well, I
help the
think the
child?
parent, it's really important to get professional help. The parent can self-educate, find out more about the symptom, but it's also important that the child has somebody they can talk to, because as with many children, sometimes the family is what's triggering the problem. So it could be that if you're a parent and you're trying to talk to the child about the maladaptive coping behavior, you're part of the problem. It will be no surprise that the child really doesn't feel comfortable discussing it with you. So, or it may be a problem that they feel like will only be worse if they talk to you about it. It may have something to do with a relationship, or it may have something to do with how the child feels about themselves and their own identity. And those times you really need to seek professional help.
Yeah, and maybe because we do a lot of family system approach, right? So when we say the parent is part of the problem, can you explain that a little bit? It's so that like parents want the best for their child, right? So it's like I don't want
Right.
I could feel defensive about that, but let's kind of look at that. That's not necessarily it's just part of life, right? It's just part of
And it's part of relationships.
right.
Anytime you are close to a person that is experiencing distress, emotional distress, your relationship will not allow you to see things objectively, because you're in a relationship. A lot of times parents get upset when we treat their children and their children respond to the staff very differently than they responded to the parent. And I have to explain to the parent, it's because we're not in a relationship with the child. The child doesn't have strong feelings about the staff. So that is something that's very important to remember. It's really a compliment, because the child does have strong feelings for their parent,
Right.
and that will sometimes cause them to need to get help from someone that is not in a relationship with them.
Yeah. And having had teenagers myself, I mean, I know that there are changes, right? And the change, and parents, we have to adapt to those changes. So it's a learning curve, and so we encourage parents to actually, you know, work together with the therapist too, not just the child, right?
Yes, we would, anytime we work with a child or a teenager, if you have to include the parent, because the parent is so important. They're a very, very important member of the treatment team.
And the you know, what happens to, I mean, like it can be a shock for parents when they find out, and it takes a while to learn. So you talk about the relationship with the therapist. Are there other ways that parents can actually, you know, take care of themselves and get support with that?
Yes, I think there are support groups available for parents that are coping with something similar to what the parent is experiencing. I think it's really important for the parent to get help for themselves as well, especially if they're having a hard time dealing with this. And I have to say, this is something that's very difficult for a parent to deal with, because our job as parents, I'm a parent, is to take care for our children and care for our adolescent. And if in this you feel very powerless, you feel like you can't help, and that is not a good feeling for a parent.
Yeah, it's very difficult. One thing that I noticed, and maybe we see that, you know, you see that on your end, is that it seems like girls tend to be more likely to do cutting. Is that something you notice, and kind of, is there a reason we see that? Is that you know, are boys finding all the coping skill differently, or what?
I think that for girls, you know, we'd like to think that society is making progress in this area, but females are encouraged to express their emotions and their emotional distress in a non-aggressive way.
Mm.
When a little girl hits, it gets a different reaction from society than when a little boy hits.
Right.
So boys tend to externalize their anger, and girls tend to internalize their and internalize their distress, not just anger, but all different types of emotions. And I think that can lead to something like self-harm or self-injury.
Yeah, that's a good point. Well, Carol, we're getting to the closing of our time. Did you have any closing comment? Any other recommendation for parents?
Well, one of my recommendations is, if you do discover that this behavior in your child, my first recommendation is don't panic, because it is a coping skill. It's maladaptive, but the child is trying to manage. And that's a good sign, because we all are managing. We're always managing at one point or another. So this means that your child is still working at this. And so it's important to give them credit for that, and to help them find more adaptive ways of coping.
Excellent. Well, thank you so much, Carol. We really appreciate your insights here and your help with this important topic. I want to remind everyone that all our previous parents chat are recorded and are on our website. We can also please join us next week. We have another parents chat, which is going to be about self-care for parents who don't have time. How many of us can say that? And so I hope you will join us for it. And in the meantime, you can find a lot of information on our website at claritycgc.org. If you're professionals, don't forget ClarityCon coming up, our conference on July 23rd. And again, thank you, everybody. Thank you, Carol, and have a wonderful rest of the day.
Thank you, Gerard.